So welcome to the inaugural event of the Wyoming 2030, an initiative seeking to broaden the public discussion about what children and families need today so that Wyoming communities can flourish tomorrow. I'm your host, Melody Edwards, and I'll be moderating today's conversation. The purpose of Wyoming 2030 is to begin a statewide conversation about Wyoming's future. A young person who enters kindergarten in 2021 will be coming of age in 2030. As the parent of two 17-year-old girls who are working to imagine their futures right now, I can tell you that the answer to this question is very close to my own heart. Wyoming 2030 seeks to engage our communities to think about how we work together to assure that all Wyoming children and families are able to contribute and flourish even amidst adversity. Our purpose today is to begin at the beginning and to explore how the experiences and relationships in a child's earliest years have long-term implications for our families, our communities, as well as our economy. We'll begin by hearing 4 short presentations that will set the stage for a discussion with citizens and policymakers. We've asked them to provide their own perspectives. We'll also have the opportunity for the broader audience, for you out there listening, to respond to a couple of polling questions and ask questions and offer your perspectives in the chat. So let me begin by introducing our speakers. Rob Grunwald is an economist with the Federal Reserve Bank of Minneapolis. Mr. Grunwald conducts research on community development and regional economic issues. He co-authored Early Childhood Development, Economic Development with a High Public Return. That was in 2003. And he's written several subsequent articles on the economic and social impact of early learning. He frequently speaks to community and business leaders, policymakers, and media throughout the United States. Amy Speaker is the Director of Community Health and Analysis at Cheyenne Regional Medical Center's Institute for Population Health in Cheyenne, Wyoming. In this role, Amy works to build partnerships between the hospital and the community to address the underlying conditions that impact health. Previously, Amy worked as a maternal and child health epidemiologist for the Wyoming Department of Health. Becca Steinhoff is director of Wyoming Kids First, an organization that advocates and provides support for early childhood in Wyoming. Becca also staffs the John P. Elbogen Foundation, and she's chair of the governor's Early Childhood State Advisory Council. She has been engaged in work with and for young children and families since 2010 and has provided thoughtful leadership for a comprehensive and collaborative vision that supports each and every child in Wyoming. Becca just got word yesterday that the federal government has approved Wyoming's preschool development grant that will infuse $2.3 million into the state's early childhood system every year for the next 3 years. Elsie Charging Crow is a home visitor with the Family Spirit Program, an early childhood home visiting program located on the Wind River Reservation. The program is designed to strengthen the health and development of Native American families. Elsie's ties to the community have been an important part of the program's growth, and you'll hear lots more about that a little later. And with that, I'm going to welcome Rob to share his presentation. Welcome, Rob.
Thank you. It's great to be with you all virtually. I'm going to set up my slides here. Oops. There. Can everyone see a big slide, title slide there on my page? Good. Thanks for inviting me to this forum. I've had a chance to be in Wyoming a couple times in person, both in Casper and at the Capitol and in Cheyenne, and I've enjoyed my visit. And we discussed these issues around early childhood development. I'm going to just take a few minutes to provide an overview about the economic case for investing in young children. First of all, these views are my own. They're not those of the Federal Reserve Bank of Minneapolis or the Federal Reserve System. So the Federal Reserve System is, as mapped here, is a combination of 12 reserve banks and the Board of Governors in Washington, D.C. Responsibilities include regulating the flow of money and credit in the economy to promote stable prices and maximum employment, oversee the payment system, serve as a bank regulator, and provide fiscal services for the federal government. Wyoming is in the 10th Federal Reserve District with headquarters in Kansas City. The 9th district where I work has neighboring states with some similar characteristics to Wyoming, particularly Montana and South Dakota. I work in the Federal Reserve's community development function, which started in support of the Community Reinvestment Act in 1977 to promote the economic resilience of mobility of low and moderate income individuals and communities through research, information sharing, and convening. Ariel Cisneros with Community Affairs at the Denver branch of the Federal Reserve Bank of Kansas City is attending today's event. Wyoming is one of the states that Ariel works in. So the research that I want to share begins within the story context of early childhood development in neuroscience. The slide that you see here depicts what happens during the first few years of a child's life, which is a tremendous growth in brain development. During the first few months and years, there could be 1 million connections formed per second in the brain. The parts of the brain that regulate sensory pathways and language are peaking in their development during the first year. The parts of the brain that regulate higher cognitive functioning are peaking during the first couple years of life. So after this strong proliferation of connections during the first few years of life, the brain starts to set itself to become efficient through pruning. It will prune away those connections that were formed but not reinforced early, and reinforce those connections that the environment suggests are important for that brain to know about. And so when children are growing up in environments at home with their parents and in their community with other caregivers where they're having enriched interactions through lots of vocabulary, words that are being spoken, a lot of interchange in their conversation, the opportunity to explore through their movement and senses, that these are children who are likely to arrive at kindergarten prepared to succeed in school. However, if children are subject to excessive adversity early in their life, this can hamper this healthy brain development, such as the stresses of growing up in poverty or exposure to abuse or neglect or household dysfunction. These are children that can arrive at kindergarten behind their peers. And what research shows is that where children are relative to their peers at kindergarten is where they tend to stay. A research study was conducted in Kansas during the number of years ago, decades ago, went into the homes of families with young children, parents with different backgrounds. They found that those children who were growing up with college-educated parents earning more income by the age of 3 had twice the vocabulary as children who are growing up with very low income. This type of research has been replicated with more modern technology, and they also find that in those homes where there's lots of turns of conversation, that helps to support vocabulary development. But these disparities we can see starting early, and it all has to do with the opportunity gaps of children and where they're growing up. Those with opportunity tend to arrive at kindergarten prepared to succeed. Those without often are behind. This research from neuroscience is backed up by a series of economic studies that ask, what is the impact of providing a high quality early care and education program for a young child? These studies come from first the Perry Preschool, which was studied in Michigan, the Opportunity Educational Child Care Program, which is in North Carolina, Chicago Child Parent Center Project was in Chicago. All three of these programs are center-based. The Perry and the Child Parent Center projects provide 2 years of preschool that include parent education, and in the Perry project, even home visits. The Abecedarian project started at just a few months of age, full day, until children arrived at kindergarten, also including connections with parents. The Amaria Prenatal Early Infancy Project is the start of the Nurse Family Partnership Nurse Family Partnership Project, which is a home visiting program. We're going to be hearing about Family Spirit, which is another evidence-based program in just a moment. All of these ratios are over 1. That means that there is a return on investment from investing in these programs. And we have long-term follow-up. The Perry Project and the Abecedarian Project, the follow-up is in the decades. In Chicago and Elmira, we are seeing results up into the 20s. So when we ask, well, who benefits the most? The majority of these benefits actually accrue to the public. Such things as reduced costs to the education system, less need for special education, lower grade retention rates. There are higher high school graduation rates, more likely to go on to college, earn more money in the workforce, pay more money in taxes, and also less likely to have costs such as crime costs. Crime rates are reduced in these programs as well. In the case of the Perry Project, there is now evidence that the children who received this high quality preschool experience have benefits. That is, there's an intergenerational transfer of the benefit of that Perry Preschool Project. You can see here that children of the Perry participants were more likely to complete high school without suspension, never be suspended, addicted, or arrested, and are more likely to be employed full-time or self-employed. So this evidence with long-term follow-up shows that there are a number of ways that we can invest in early childhood development, such as access to high-quality early care and education programs, looking both at access and the quality of the program, such as the training of the teachers and the curriculum that is used in those programs for infants, toddlers, and preschoolers. Home visiting is another intervention that has evidence base. We'll be hearing from soon about Family Spirit. The intersection between child protection and early childhood services is a place where society could achieve a lot of benefit in understanding how we could bring more value from those connection points, and health and dental care. We also look at early care and education, its role of childcare. It's really a 2-generation investment. Childcare allows parents to decide to enter the workforce, and when it's reliable and accessible, parents are more productive at their work, and this can have an impact on households, businesses, and taxpayers. A study that the Minneapolis Fed helped support in Montana, just to the north there, shows that there was about $232 million lost to the Montana economy because of inadequate childcare and unreliable childcare arrangements, including losses to households, to businesses because they have to find workers and retrain and attract them again, and also losses to taxpayers. And I'll conclude with noting that the childcare business model has a number of challenges. First of all, the clients are young families. They're early in their earning careers and also have a lot of expenses with household formation. There are also families that it's harder for them to afford childcare. And childcare is based on labor. You need to be able to have labor in order to provide it. And already the wages for those who work in childcare are relatively low. So coming into the pandemic, there are a number of challenges with the business model. COVID has brought a number of additional costs to providing safe care for children, as you see listed here, that have to do with health and safety. Also operating with smaller group sizes. Each one of these is very important, but it's been also raising the grain on the importance of how do we provide financial support to the sector so we can help parents participate in the recovery, the economic recovery, as we move forward. So thank you, and I will turn it back over to Melody.
Okay. Thank you so much, Rob. So now let's hear a little bit about how this question of the economic value of investing in young children fits into sort of the broader context of the health of our communities. So I'd like to pass it along to Amy.
Great. Can you all see my slides? Great. Thank you so much for having me. My name is Amy Speaker, and I'm delighted to be a part of this conversation and talk about how social determinants of health impact children and their families in their community. So often when we think of health, we think about going to the doctor, getting our flu shot, or taking medications. But when we actually look at what contributes to health, it's a little bit different than that. As you can see from this slide, only about 10% of our overall health is determined by the healthcare that we receive. Health is really kind of determined where we live, learn, work, and play. And the underlying contributors to this are what are called social determinants of health. So let's talk a little bit more about what those look like. You can see the social determinants of health here listed across the top of your screen: economic stability and across. And I kind of want to relate those back to those contributors to health. Some may be clear and some may be a little less clear. So when we think about individual behaviors, often people think about exercise or the food we eat as important contributors to our health, which they are. But I think sometimes people don't think about how our neighborhood and physical environment impact those choices. So for example, if you feel unsafe in your neighborhood, maybe you don't feel comfortable going out to exercise, or as many of you probably experience in Wyoming, there is no sidewalk. And so maybe it's a little dangerous to be out running on that side of the road and people going 60 miles an hour. So maybe you choose not to exercise in that way, and that's contributing to your overall health. Here in Cheyenne, if you don't have a car and live quite a ways from a grocery store, thankfully we have public transportation, but you're only able to take 2 bags on the bus. So how are you supposed to do all of your shopping? Maybe it's more convenient and cheaper to just go to the fast food joint that's in your neighborhood. When we think about our healthcare, that one's maybe a little bit more clear how that contributes to our health in that 10%, but it's not equal for everyone. What language do you speak? Do you speak the same language as your provider? And what about your access to care? Are you insured? Do you have a provider in your network, in your area? All of these things contribute to our overall health. Then when we look at our environment, for example, thinking about housing. If you have asthma and you live in a house with mold, no amount of asthma medication is going to be able to solve your asthma problem, only addressing the mold in your home. So we can see how these social determinants really underlie many of these components. Now, the last one on the list was genetics, and you may think, no, genetics are pretty set, but actually there's quite a bit of research out there about how our genetic code interacts with our neighborhoods and environment through a process called epigenetics, but I am not a biologist and I'm not gonna go there, so I encourage you to Google some Science Friday episodes on that one. But we came here to talk a little bit about early education and early childhood. And so how does all of the social determinants kind of intersect with that? Well, I think the life course perspective is one of those ways. And Rob kind of hinted at this when he was talking about how important that first year of life is. And the life course perspective posits that there are both negative factors, arrows pushing down on us over our life course, and protective factors pushing up, helping us achieve our potential. But there are different periods within our life where that's pretty critical and more critical than other times. And one of those is during pregnancy. So we look at things like whether you were born at a low birth weight, and it's predictive factor for whether you have diabetes, heart disease, or high blood pressure in your middle age. So we can see that that is really important. The other thing is that these events are cumulative over our lifetimes. They don't just happen once and then it's the same, we address that next risk factor with the same set of resilience as we did before. All of these different protective and risk factors come together to shape our life course. And so those things kind of stay with us as we go. So we will see that in some examples like adverse childhood experiences, which you may be familiar with, but they are potentially traumatic events and environments that really impede the safety and stability for young children, well, children under 18. And those experiences can be violence, abuse, you can see them here. And what we see is that these experiences stay with you throughout your lifetime and are cumulative. So as you, we there's documentation of people who have experienced these negative events in their childhood have long-lasting effects in their across their life course. There's over 40 documented associations between ACEs and these long-lasting effects, and you can see some of those here. So again, really thinking about how it's important that we invest in this early childhood phase where we know the experiences are going to be predictive of what happens across a lifetime. Now, I say predictive, that's all just statistics. You know, these experiences are not your destiny, and of course, that's why we're looking for interventions and activities to help promote health throughout this time. I would also be remiss if I said that we experience social determinants of health equally across our communities. We don't. There are differences by when people experience racism, sexism, discrimination based on gender identity, all different kinds of discrimination. Here I've highlighted a few of the areas where we see gaps related to race across the country. And as you can see, one to start with there is the socioeconomic status, with Black families, white families being 10 times, having 10 times the net worth of Black families in our country. And now you may say that this is what's happening in the US, but it's not happening here in Wyoming. But I can guarantee you that it is. And that these type of socioeconomic and social determinants of health gaps lead to health disparities that we see. One example that's really pressing right now is, of course, when we look at the effects of COVID on our Native populations in Fremont County. We have seen great disparities. At the beginning of the pandemic, even though our Native population is only 2.5% of our population in Wyoming, they experienced almost 40% of the cases at the beginning of this pandemic. So we really can see the implications of the lack of health equity. As an epidemiologist, I sometimes like to describe the problem a little too much and not think about what we can do about it, but I want to tell you that there's a lot. We can start looking at public policy, thinking about what supports we have for these early childhood programs and investing in these evidence-based programs, as Rob was talking about, but also thinking about the systems that we've created. Who has insurance in our communities? Who doesn't? How does that affect which kids are covered? What community partners are working together? And I think one that we can all do is looking at our own organizations and thinking about the policies we have in place at an organizational level that can either support or disincentivize the promotion of social determinants of health among our own workforce. So I know we came here to talk for what 2030 is going to look like in Wyoming, but I think if we really invest in early childhood, we're really investing in a much longer time horizon for Wyoming. And I'm excited to hear all your comments and thoughts about how we can do that together. Thanks.
Thank you, Amy, and thank you also for that plug for Science Friday on NPR, much appreciated. And we're gonna have an opportunity to talk to you again a little later, Amy, so we look forward to that. For now, Becca, based on what you have been hearing from these presenters, you know, what does the situation look like on the ground in Wyoming?
We are in an excellent place in Wyoming for early childhood. We certainly have work to do, but I am delighted to be the person that shares a little bit about what's happening now in the state. And I think we could have spent many more minutes this morning on this topic than I was allotted. So I'll be brief and look forward to the conversations that follow. When we started conversations about Wyoming 2030, we defined long-term success for communities as having self-sufficient young people who believe in themselves and who mature into healthy, productive parents and citizens. And we knew that that conversation should intuitively begin at the beginning. And that's with early childhood. So part of the discussion today is to activate your curiosity by sharing more of what we know, the science and the research that both Rob and Amy shared, and then ask you to reflect with us about how that science informs or ought to inform what we're doing in our state and our community systems to care for and educate our youngest children, our youth, and our adolescents to achieve that vision of long-term success. And so I this morning want to share with you a little bit more about Wyoming's early childhood ecosystem. We've had a really wonderful opportunity with a federal preschool development grant that invested $2.1 million in Wyoming in 2020 to reflect on some of these questions ourselves. That grant allowed us to conduct a comprehensive statewide needs assessment that led to a statewide strategic plan for early childhood, the first time that we've ever had a comprehensive statewide strategic plan for young children in the state. And as part of that, we wrote a vision. And so we said that Wyoming envisions a future in which all children are safe, healthy, nurtured, and prepared for success, the successes and the challenges ahead of them in school, the workforce, and life. So certainly not tied to that early childhood period, but really thinking about the trajectory that their life will take. We wanted all families to be supported, stable, and economically secure, hoping that they help their children explore, grow, and learn in safe and nurturing places. And that communities in the state would collaborate to align resources, programs, services, and policies that maximize outcomes across family supports, health, and early learning. As a part of this vision, what you'll notice is that it's long, and it's long because we knew that there were a lot of dynamics that fit into this early childhood space, and that we would be remiss if we didn't acknowledge that both children and adults are critical in this space. And within each one of these, there's a focus on relationships, environments, and experiences. And we look at those as levers for change as we think about the work that's ahead. That vision also acknowledges that we'll hold children in the center of the work that we do together, and we'll think again about those relationships that surround them. So we would be thinking about families, caregivers, and educators, medical providers, and other professionals. Perhaps it's the librarian in the local library, or another individual who has a close relationship or connection to a family and a young child. We want to think about the environments where children are spending their time. That could be in their home or their neighborhood, the programs that they access with their families, schools or other places where they're spending that time and receiving experiences as they learn and grow. And then we want to think about the local and the state systems that enrich those relationships and environments and experiences for young children. In the state of Wyoming, this is a depiction of our state system. So I put this here knowing that it's a little bit blurry, but also want to capture and acknowledge for just a minute that it's a complex system. And so we are continuing to do some work on this system to make it navigable and more coherent for the sake of young children and families that it serves. So we have several entities and funding streams and priorities in the mix. And as we look ahead, one of the things that we would like to do in this state is strengthen this early childhood state level system that connects very much so to the federal system and community systems to make sure that it is optimizing opportunities with funding and services for children and families who access them in the state of Wyoming. I mentioned that we conducted a needs assessment, and that needs assessment really looked across that system at both the state and the local level and asked, what is it that we know about how children are doing, how families are doing, and how that state system is serving. We also asked, what are some of the strengths that exist in our communities or other spaces as we consider the work that might be done or leveraged as we move ahead. And so what's on the next few screens, I apologize, is text heavy, but I wanted you to have a sense of the key findings that came from that needs assessment. I'll note that it's close to 300 pages. So this is a very watered down version and a prioritization of some of the key findings that are in that document. So the first set that we'll look at falls into that governance and systems space, where the needs assessment noted that state level administration of early care and education and B5 birth to 5 programs is distributed across multiple agencies with limited coordination and services among those agencies. So some of this work came from a bipartisan policy center analysis that ranked Wyoming 49th out of 50 states for their integration of early childhood programs. That analysis was done in 2018. And so we've been able to look at that report and have conversations among a group of stakeholders in Wyoming to think about how we strengthen and better coordinate that governance system. The needs assessment also noted that some early childhood providers and families have concerns about increasing the role of government in early care and education. And specifically, there was a concern regarding additional requirements that might be associated with state funding. And so we know that the state has long had a perspective on how to engage in early childhood. Their primary role has been to support families as that first and most important teacher and allow families to choose how to access the system. We view early care and education programs largely as private businesses and entities that the state does not want to over-regulate, and there's a strong perspective that we need to find a way to balance that long-standing philosophy with what opportunities might be ahead to strengthen that early childhood system. We also noted that the current data collection in Wyoming is lacking, and that data collection is largely carried out in relation to federal reporting requirements. So there's a lot that we don't know that we would like to know about the state of young children and early childhood systems in the state of Wyoming. We also looked at quality in early care and education programs around the state. Wyoming is one of the few states in the nation that has been last, I suppose, to identify a vision for quality, setting the high quality basics that we want for children in those earliest years of life. And we found through two simultaneous processes during 2020 that stakeholders generally agree on certain elements of quality. So we're looking at safe and supportive environments, positive relationships, and family communications. Academic learning was recognized as important, though just as much there was a focus on play, exploratory learning, thinking about being outdoors, as well as a focus on social emotional learning as they all relate to the overall health and well-being that we want for children. The early childhood education workforce in Wyoming includes more than 2,870 individuals. These professionals earn low wages, and especially in comparison to those who are counterparts in that K-12 system. You can see some of those compensation disparities on the screen, but this lower wage means that we tend to have lower educated workers in the childcare workforce, fewer benefits, higher rates of teacher turnover, and other sets of challenges that come to that workforce. In terms of quality, we know that the Department of Family Services administers childcare licensing requirements that include staffing requirements, annual training requirements. They meet basic health and safety standards, and so we certainly have room in the state to consider how to implement a broader vision for quality and mechanisms to achieve that quality in programs so that children and families have access.
Looks like Beckett is locked. Okay.
Are fewer services available than what is necessary for young children and families. In many cases, there's low awareness of available services and supports for young children and their families. And we also noted that childcare is more expensive than many families can afford. So the annual cost of childcare in Wyoming for infants is $10,647. So that's a significant cost burden for families. That's the cost for one child, one infant for 1 year. So you can imagine, many of you probably know from firsthand experience, that's quite expensive, and others can see that number and empathize. Some of the other family findings in the needs assessment included improving family engagement and knowledge of child development as a priority. parents and families tend to learn about services and supports primarily through word of mouth and social media. And the availability of kindergarten transition information, services, and supports varies across the state and depends largely on the relationships at the local community level. And then there was a strong sense that parent and family voices are not always valued or respected at the systems level. So certainly this gave us a strong sense of work that could be carried out as we moved ahead. And part of what we wanted to do in this work that connects nicely to this Wyoming 2030 vision is to really think about how we connect health and learning. It's really easy when we speak about early childhood to think about health or learning. And we recognized that there's a need for a more comprehensive approach to this work for young children and families. And so we've heard this morning already that strategic action and investments in young children and the adults who care for them and educate them affect long-term physical and mental health as much as they affect early learning. And that was central to the work that's ahead for early childhood in Wyoming. We also heard that investments in and resources for those earliest years of life can yield a significant return over time. And with that, what's ahead for early childhood in Wyoming very much acknowledges and lifts up the importance of adult-child relationships, environmental exposures, and early experiences because they influence child well-being. And so we know that the conditions and environments where children develop affect that lifelong health as well as educational achievement. They are connected and they need to remain connected. We also know that the foundations of health and learning are built early. So our conversations really begin prenatally and focus on those first few years of life all the way through age 8. And we're looking for short and long-term outcomes in learning behavior and physical and mental health. The same group that worked so diligently on a needs assessment has put together a strategic plan. It's a 3-year plan that looks at the 6 components that you see on the screen that acknowledge the connectedness between health and learning and holds that vision in the center. And so the state has really identified, again, a comprehensive approach to this work for young children and their families that sits in these 6 areas. And so we look forward to continuing that work as we move forward and know that indeed there is a great deal of work to be done. As was noted by Melody early on, the state received word yesterday of a preschool development grant that will provide the state with additional funding for the next 3 years, $2.3 million per year to be invested in this work and work that is beyond for young children and families. So we're looking forward to the opportunity to maximizing those dollars and leveraging the resources that already exist within the state to move toward this vision that we have for young children and families. One of the things that we wanted to do with Wyoming 2030 was also recognize that there's an increasing number of programs around the nation and indeed within Wyoming that reflect that intersection between health and learning and provides interventions that support that dynamic interconnectedness across local communities. And so it is my privilege this afternoon to introduce Elsie Charging Crow with Wind River's Family Spirit Program. This is a program that we're thrilled to be able to highlight. It's an early childhood home visiting program that helps to strengthen the health and development of Native American families, and it has been lifted up in many ways by others around the state and the nation as an exemplar for what is working very well, both within that early childhood home visiting space and otherwise. But Elsie will be able to tell you more about what's happening at that program and how they're working across that system to really support young children in the families that they're learning and growing in. And so with that said, Elsie, I will pass the mic to you.
Okay, thank you, Becca. Yes, I work with the Family Spirit Program, and we've been, this is our 3rd year going into it. We're a home visiting program from 28 weeks, the mother's 28 weeks to 3 years old. And we try to increase like parenting knowledge and skills, parenting skills. And then we address like maternal things that could have risks that could happen. Like we have lessons of drugs in the community or what alcohol use can do, even depression. And we talk about domestic violence, how that can affect the pregnancy. And even, and then in our lessons, we also do educational, and we try and help them, like if they don't have their GED, we'll try and help them get their GED. If they're planning on going to work after they complete their GED, we find resources, we help them make their resume, we'll take them to the Terrell office. We'll collaborate with everyone possible here on the Wind River Indian Reservation. And we promote like physical activity. From what Rob was talking about, and Amy and Becky, everything you guys had talked about, I could vision what you were talking and how important it is. And I see that preparing children for early school success and health, like their immunizations. That's another thing that we do. We have a couple of lessons on immunizations. We try and address anything that's going on in their life right at that time. Even if it's like all our mothers, and not all the moms, but most of our moms and the fathers have all had something in their life, like if it was alcohol, abuse of themselves using alcohol, or their parents using alcohol, them taking drugs, or their parents taking drugs. Domestic violence, if she or he, we've even had men that had experienced domestic violence. We try to find those resources that are right here within our Wind River Cares. And if we don't have that, if we don't have a program, which most of the time we do, I mean, our clinic is growing, and we go through some of the challenges of growing with, like, even I was talking with Michelle this morning, one of our things is finding offices. Sometimes we have to move offices, and sometimes we'll know like in 2 weeks. Sometimes it's like, well, I'm sorry, we didn't tell you guys, but you need to move today. And so but as Native Americans, that's one thing that doesn't bother us. That's one thing that doesn't, we're used to moving camp. Our ancestors moved camp. Like, our warriors would come in, our braves would come in and say, there's a cavalry down here, or there's this other tribe that's, coming in, so we need to get out of here. So our ancestors just picked up, and the women are the ones that everyone thinks it was the men that put the teepees up. It was the women. The women did the teepees. And so with that, we're not, with that moving around and having to change directions, we're used to that. We're used to doing things like that. And that's what we try and tell our young moms, that you need, you never know. There's no parenting book. There's no book that will tell you, exactly how to raise your child, but we can find things for you. And one thing that we share with the women at the very beginning of, because we have young moms that are like 14 years old, and they feel like they did something wrong. And so we go and we tell that mom that, where you're sitting at, a lot, our tribe, where you're at right now, you're creating life. Okay, the only other person that can create life is our father, our grandfather, the Holy One. And so that's where you're at, because you're creating a life there too. You know, respect yourself, and you need to know that you're doing something well, and you need to fix your body so that you can prepare the little one that's inside of you. And then we'll go into nutrition, or we'll go into even like if they're in a domestic place, we'll try and get them out of there. We'll try and get their mindset right. And if they're abusing, we tell them what they're doing to their child. And we start right there. We start right there when they're still carrying. And as time goes on, and even like like Rob, I could tell that and even Becca, that you guys have already looked into our family spirit, and you've already seen some of the things that we do. And Amy, when she talked about the health and the exercise and the education, that's in our curriculum too. We have 63 lessons that we go over, and the modules are prenatal care and infant care, your growing child, your toddler care, and my family and me, and my healthy living. And all those modules, everything that you guys had talked about, even like when Rob talked about the economy and he had talked about the years, the one thing that I worry about our young moms, our young families, is that when they're 3 years old, and how Becca talked about collaborating with others, that's what I want for family spirit, because we just take them until they're 3 years old. And some of the moms that their children are over 3, then we see them, and I would like to continue to try and help them grow, but our curriculum only goes so far. And so it made me have that ideal of the other resources, the other parenting programs that are out there. If we could put that into the family spirit of finding that next step into the next, after they're 3 years, their child is 3 years old, and kind of just go over with the next educator a little bit about that family, and what we're handing over. So like a scenario would be like, here's so and so, okay, her son is 3 years old, she's had these struggles, and they're not just regular struggles. I mean, we've had one lady that she took the classes, but she didn't plan on keeping her child. She said, I'm not going to keep my child. I know I can't keep him. So we went on, and when I asked her, why aren't you going to keep your child? And she said, because I can't hear. And I said, well, how do you hear me? And she said, I'm reading your lips. And then so I went and I said, you can't hear at all? She said, no. And so we got her hearing aids. We set up an appointment for ENT, and she can hear now through her hearing aids. And so she kept her child. And after that, she said, I got older children out there that have been raised in foster homes. I'm going to get my children back because I can hear them now. So she got them back. And now that we're in COVID and we have masks on, no matter what, when I go to her house, she'll sit in her car and I'll sit in my car, because we got, we're social distancing. I can't be 6 feet away from her and have my mask on, because she won't hear me. I mean, she can hear what she wants. And I guess the muscles in your ears, if you don't exercise them, then you can't use your hearing aids. So, but if we sit in two different cars and I'm facing her and I'm doing my lesson, and even though she's in another car, she can read my lips. And so we do lessons like that. That's the only way we can do that lesson is with her seeing my face so that she can read my mouth. And so, and she's doing well. And if you look into that Urban Institute, the ones that John Hopkins came out and videoed about us, she's the only one that didn't do a video. And the reason why she didn't do a video is that some of her language isn't right. She says it the way she hears it. And so she didn't want to be on a video because she was afraid she was going to mess up. So she didn't get on that video, but her picture is on there. Her picture is on there and she's sitting there in a lesson. And she talks about how she had no self-esteem and now that she's able to watch her kids. But that's what Family Spirit does. I mean, whatever that challenge is, we want to help that mom. We want to help that parent. We have some fathers. We have mothers that have left their children, but the fathers are still trying to make it with their kids. So we've helped them and we're still working with them. Whatever their problem is, we just want to try and help them find solutions. I mean, because we see all kinds. And when all of you guys were talking, that's just true. I mean, but the one thing I really worry about is in 2030, like our 3-year-olds, they're going to be like 12 years old. And I've raised 9 kids. I mean, I raised my own kids, but now I have 9 kids. And some of them, I raised them from birth. But one thing I see is that when they're 12 years old, I was looking at Rob's graph, and when he got to 14, I just hit right on, because when they get to that age, and then I was looking at Becca's, like if they had come from, and I was looking at all of them, like if they come from an educational family or not an educational, or their family had used, or their family drank. You see those 14-year-olds, and I tried to advocate for 7 boys at Arapahoe School because they were suspending all of those boys. And they didn't stand by those boys, and they didn't try to help them finish out their 7th grade year. I think they were 12 or 13 then, but they didn't try and help them finish out that. There was, out of those 7 boys, there was only 2 that made it through virtual learning, like how they're doing now. That's the way they had to finish out their year. And then when it came time to move on to the next grade, both the boys went on to 8th grade. One ended up getting in trouble. The other 2, there's 2 in Worland, there's 3 in St. Joseph's, and those boys just didn't have anyone to stand behind them. There's only one boy that is doing well, and when this virtual learning started, he was the only one that was going around showing his friends how to do virtual learning, because that was how he had to do his 7th grade work, because he was expelled from his school and he couldn't go to class, but he had to do virtual learning. And so when this started, and everyone that turned from him and didn't want part of him because he was a bad boy, he got in trouble, even the teachers. Then the following year, when we're in virtual learning, they're like, get a hold of this boy. He knows what he can help you with virtual learning. And so, I don't know. I see good in some of the educators, and I see bad. And usually, I'm a grandma, so I just call them out. I just call them out on it, because they could. I mean, I don't know. My kids probably get in trouble for it in school, but I don't know. I just think that these kids need to, no matter if they have one person stand behind them, They'll try. They'll make something out of themselves, because they'll go back and say that someone cared. But yeah, so that's what Family Spirit does, and like I said, I think when they get to the next parenting, I think they should, get together let us meet their next educator, or let us refer them to someone else, because 3 years old, I don't think is enough. I think I'm Family Spirit, and I believe in it, but I still think that we should at least go to 5. So I think I'm past my time, or our time.
Well, thank you so much, Elsie.
Yeah.
This is such a great example of how all this research that we were talking about earlier is really working on the ground, and how that work is really adapted to fit, different cultural lifeways. And so we're going to transition now to our front row participants, and I'm really interested to hear their perspectives and their questions on all of this stuff that we've been hearing. So let me introduce them. Diana Clapp is the former superintendent and coordinator for the State Board of Education. Senator R.J. Cost is a state senator for District 19 in Park and Bighorn counties. Amelia Eckert is a parent in the Bighorn Basin. And Dr. Joseph Horam is the chief medical officer with Blue Cross Blue Shield of Wyoming. And Letty Liera is the director of Early Head Start and Head Start at the Children's Learning Center. And then we also have Representative Albert Summers is with us. He's a state House representative from District 20 in Sublette County, and he will be the House Majority Floor Leader in the upcoming legislative session. So welcome to everyone, and thank you for joining in on this most important conversation. And I am hoping that this will very much be a conversation. I invite you to ask each other questions and to challenge each other when you don't necessarily agree. And that's the way that this panel can be the most proactive about making real change during these very stressful times for our Wyoming families. I just wanted to start I just want to kind of pick up where Elsie left off. I know that when I was, a new mom with 2 baby twins at home, it was a very, very struggling time. A lot of what you guys have been talking about, that was me. We were, struggling to get our home put together, and our funds were very limited. I was on WIC. And one of the nurses from the program came to my home each week, every few days, to check in on me. And I really appreciated that home visit. I relied on it to help me figure out nursing, to figure out the details of becoming a new mom. And so I was going to start by getting the conversation going by talking about, do you think that a program like the one that Elsie is describing, Family Spirit, this home visit program, is that something that we can scale up to the level of the state? I wonder if some of you might start by just kind of speculating about the possibility of that.
Melody, this is Letty. One of the things that resonated with your question and what Elsie was sharing is the fact that adverse childhood experiences it's sobering, the fact that 64% of us will have a experience that is traumatic. And if in addition to that you layer poverty or lack of access to anything else, then you have a huge issue that can be assessed by what Elsie said, which I love, is like somebody needs to be behind you, has to have your back. So to kind of diminish this situation. So I do believe that if we could replicate and expand the H's, we would have like half of the solution there. My question to Elsie, though, is just by the nature of the business, how do you take care of your staff? I think that's one of the challenges that I found in Head Start, which we also serve low-income families, have a home visiting program, and I'm trying to find innovative ways to take care of our staff as well, because I do believe that in Wyoming we do have the talent, and it's a matter of connecting the dots. But I don't know if Elsie, you can talk about that a little bit as well.
Elsie, can you answer that?
Okay, so what I'm understanding is that you're asking how do we take care of our curriculum, or how do we take care of our
Your
data?
staff, the people that are working in the program and making these visits and making sure that they're safe. And maybe, you know, if I'm understanding your question, Letty, you know, just like, is your staff feeling like they can handle, because they are encountering families and homes that are going through a lot of trauma. How do you take care of your staff to make sure they're, you know, handling all that?
We came up with guidelines for social visiting, and they know. I mean, I let them choose. I have a referral sheet, and I let them choose who they feel comfortable with, and just kind of give them a little background of like, okay, this one is 22 years old. Okay, she has a 2-year-old, and she's 4 months pregnant, and she lives in this community. We had different communities here, and so they'll go off that that referral list, and usually once a name gets put on that referral list, by the end of the week, someone has to step up and say, okay, I will take, you know, and they'll put their name by them, and they'll have the information, how to get a hold of her, how to where she lives at, her phone number, and then we meet maybe once a month. And sometimes if it doesn't work, they'll come forward and they'll say, I can't get her to, you know, she said she wanted to, but now she don't want to. Okay, so then I'll say, okay, well, you know, this is what, okay, she's this age, I think she would go good with this one. When we started our staff, my vision was to have different tribes, because there's no Northern Arapaho, there's no Shoshone full bloods anymore. They're either Shoshone and Arapaho, they're either Northern Cheyenne and Arapaho, they're Navajo and Arapaho. So anyway, my vision was to hire a Shoshone, to hire a Navajo, to hire a Northern Cheyenne, a Sioux, just all these different ones. So then that would be another thing, that when it came down and we found out what tribe she was, because we have different traditions, then if something didn't work, then that's who would be their educator. Sometimes it doesn't work. We had this one like girl, and she's like 15 years old, and she signed up on her own, and she just, after a while, she was like, no, I don't want to, I don't want to, you know, I don't want to take family spirit anymore. And so we're okay. And our place is so small. And last night I walked into Walmart, and I didn't know that this other lady was her grandma, but I recognized her, and I remembered that she wasn't joining up with us, that she was refusing. So I walked over and I greeted her grandma, and I said, I really wish you would give us a call. I said, you haven't, you know, I said, I know the girls tried to reach out to you, but you wouldn't, you didn't respond. You didn't want to sign up again. And her grandma was like, how come you don't want to sign up? And she said, oh, I don't know. Yeah, I will. And she said, call me. I said, no, you call me. And I said, give me your phone. So I put my phone number in her which call, and I put my name there. I said, at the end of the week, if I don't hear from you, I'll give you a call. And she said, okay. So anyway, I've been here for many years, and so I kind of know them. And she's a Shoshone, but but I know her grandma. I mean, we've all seen each other. Another way that we is the maternal child health nurse. As soon as someone comes to her, she'll put her name on the referral list, and she'll get that same information. And sometimes I don't know who, like I know their parents, but I don't know them. But like I said, at the end of the week, one of the educators that knows a little bit about it and looks into it, and they reach out. And if no one, like maybe come Friday, no one takes her, then I'll assign her to someone.
Yeah, and
I
it's so
kind of,
I'm seeing that that I did hear from Amy, and she's saying that Wyoming does have a home visiting program like this in each county, thanks to some legislation about 10 years ago. And so it sounds like what you're saying, Elsie, is that, you know, one advantage is being able to pair some of these folks in your community that are going to be really good matches for families, and that sounds like a very personalized care. And I've been thinking that that's something that we are probably all, you know, Wyoming is a small town with very long streets, as we all like to say, and that's one of the benefits of having programs like this, is that we can sort of make them more personalized. I did want to, you know, find out from Senator Cost and from Representative Summers, you know, I wonder if you can talk a little bit about the mood. Is there a will in our state right now to do some of these kinds of things, some of the things like what we were just talking about with Elsie, programs that are going to be more personalized and really start to get into people's homes? Maybe the legislators can talk a little bit about the mood in the state right now during a pandemic to make these changes.
Melody, this is Albert. I'll take a stab first and then let RJ, who is a lifelong educator, kind of clean up for me. But you know, first of all, I want to say to Elsie, bless your heart. You know, what a wonderful story, and the work you do. You know, bless your heart. I think the challenge is, and it kind of goes to what Elsie's doing, is she's in a culture, right? And she understands her culture. And I think there are various cultures in this state of Wyoming, and some of them are very leery about early childhood education and you know, people, I guess, particularly government, getting into in the families. And so I think one of our challenges, but I think it's certainly overcomable, is how do we get people from all these different cultures that exist in Wyoming to recognize the importance of this, and that it's not scary, right? We're not trying to steal your child. We're trying to help you as a parent. And I think that's so critical, is to understand the cultures we have in Wyoming and how we do that. And then, of course, the money issue. And we don't have a lot of money right now. We're cutting money to everything. And until the people in the state of Wyoming realize that, you know, come to terms with the fact that we probably need some more revenue, we're going to continue to cut programs that Becca works in and Amy's talked about, and probably some that Elsie's working with. And so we have to come to terms with that as a state, and we're not there yet.
And Senator Cost, do you have a response to kind of just, you know, how are we able to do some of these things?
Well, I do have a couple of responses, and a couple of them relate to the area that I've been in Park County, and some of the things we've done here, but it also, I think, relates to the whole state. Not everything has to be built around money. A lot of times it needs to be built around communities and community care. And how do we develop that social careness for the people in our communities? Albert's right when he talks about there's a lot of different cultures, different climates around the state, but the banding together of those different cultures for the needs of the people that are in their philosophical beliefs or whatever is essential. And with the internet and the ability for grouping people that want to be together, we have a lot more opportunities available to us to get people connected. Liaisons, we used a liaison between the preschools and the school district to help keep everybody on the same path educationally. But when we talk about from birth up, we're talking about all different kinds of needs that these people need. And in order to meet that, I think it's essential that as a community, we start stepping up. As a community, we say, okay, how can we partner together and not overburden some that are willing to do this so that they are so loaded down that they get exhausted and say, enough, I can't do anymore. At the same time, not only does that become necessary, but as a state, we need to start realizing the value and what our youth have to offer to our state in the future. And if we don't invest in them, how are we going to expect our state to be economically in the forefront as far as able to be a leader? And it's very important for us to get to that point as well. But it's very difficult because in hard times, everybody is struggling with different needs, and nobody wants to say, we need to look at taxes or we need to look at this or that. But somewhere through that cloud, we've got to try to work through and say, what is it that's going to be best for the communities of our state and for these young kids? And if we're not willing to invest in our young kids, then who are we willing to invest in, and how's that going to make a difference for the future? So I think it's important that we look at all the sides. I still stand by the idea that money is not the only answer. All too often we turn to money and say, well, give us more money and it'll work, and it never does. It seems like the more money we want, the more money we get, and the more money we get, the more money we want. And it doesn't matter whether it's our own individual income or whether it's any kind of an organization. But how can we really come up with that gathering? Elsa has such a great outlook on what she's talking about. And if we can hopefully cultivate that to more of the state, it brings more opportunities. But again, we got to see the value of our kids and why we need to invest in them, and both money and the caring of our communities and our people.
Yeah, and so I'd love to hear from some of the other panelists your response to what you're hearing on about that sort of the mood of the state right now, especially from you, Amelia, as a parent up in Powell. I'd love to hear your thoughts on when you hear what these guys are saying. What does that make you think as a parent?
Okay. Yeah, I think what I'm hearing a lot of is that we want relationship and mentoring. And I think absolutely the state can kind of start that, but then encouraging the moms that you do have mentorship with and take on another mom that they can then pass on the information to, because that's kind of the model, right? Of like a multi-level, like you take one person and it exponentially grows the more people that you can get involved in sharing the information. And then those relationships are built. And so it's not this like, hey, we're the government, we're coming in to teach you how to deal with your kids. It's other moms coming alongside of other moms to mentor and to teach and to train them. I think, yeah, everything I'm hearing is just that everyone has the heart for the same outcome, to have just thriving kids, and somewhat, kids who can go off into our future and to thrive and to grow. I kind of like to think of my kids as arrows that we're shaping now, and the trajectory that we can send them off. If we train them and teach them well, then they will continue, in their life to make something of themselves, like you said, Elsie, and to have someone believing in them, I think is also something, Elsie, that you mentioned. If they can just know that someone is there for them, and whether that's their parents, and we're encouraging that through mentorship, or whether that's through, a program like the schools or early childhood education, or the Best Beginnings. That was also huge, just to have someone. When I have 5 kids, and with my first couple, I had the Best Beginnings program come in and weigh them and make sure their color looked okay, just because as a new mom, you're like, I don't know, like what's normal and what's not. And so having someone that was a mentor to me and then could help me get connected with the other places that could then, perpetuate that growth.
Yeah. Now, when I'm hearing what a lot of you are talking about, we're talking a lot about, reaching out to families. One of the traps that I wonder if we want to try and steer clear of is not ending up patronizing certain groups, especially because a lot of these discrepancies that we're seeing, whether it's, in Wyoming, really high numbers of those adverse childhood experiences. We do have a higher than average, numbers of kids that are experiencing those, very low birth weights. We do have a lot of problems in our state, and they are predominantly falling into some of the minority groups. And I know that we want to be careful about patronizing these groups. How can we find ways to reach out to communities, rural towns, as Senator Cost was saying, really trying to create that community feeling, making sure that we're collaborating. How can we make sure that we are reaching out to these families and not shaming them, but embracing them?
Well, I'm going to take it.
Yeah, anybody want to take a stab?
I'll take a quick stab.
Thanks.
I'm gullible. That's a really challenging question, but a couple of mentors, coaches to teach others to coach as well and to train, and to start out with a few in a coaching situation where we're saying, okay, here's the approach we want to take. It's not about the background. It's not about the way they are or where they came from. It's about how to grow your child and how to make the best for what you're working towards, and to always look at the positive side. And the forward move is to look at the sun coming up instead of the sun going down. How do we make a culture and a climate that speaks for the needs of our people? We can talk about something and we can teach something such as a culture anywhere, and we can all say, yeah, we believe it, but the climate has to correlate to that, or it's never going to become a reality. And so how do we find good coaches that can help others become good coaches, and just slowly over time spread that out through the state so that there's a number of people supportive to everybody? And when there's challenges of maybe something so different that somebody's having trouble with, they can reach out to other coaches who might be able to assist. So open-mindedness and working that way, to me, would make more sense than anything.
Anybody want to respond to that? I know we haven't heard from Diana, who I wonder if you might respond to what he's saying there.
Certainly, thank you. I'd love to build off what Senator Cost was sharing there. In my perspective, comes from that of a former superintendent that worked in our district to develop early childhood programs, actually from birth through kindergarten. And everything that's been said today so resonates with me. But I think that piece of that community, what Senator Cost talked about, is so important. There's more, I believe, that we have in common than what we have in differences. So when we looked at as a district in a community that is conservative, that was hesitant about a school district seen as government involvement in their family, but when they saw the common needs, for instance, we had teacher loss because there was no available childcare or preschool services in our district. And they weren't willing to continue to work in a district and have their child served 30, 40 miles away. So teacher retention was an issue. Teacher recruitment was an issue. Teacher discouragement and the achievement gaps were an issue. Then we had poverty issues, we had access issues. But when it all came together, the need was to take care of our children. Here's our children on the ground, here are the needs. And you may have approached it from a different lens, but the community was able to come together and see that the need was shared. It wasn't a problem of a particular group. It was a community-based need and issue. And then, of course, we had some legislation, the Department of Family Services, Department of Ed, and some foundations that were willing to help us put some of those pieces together. But I would like to share also, you know, we saw those achievement gaps close in students. We saw the real impacts of you can pay now or you can pay for those remediation services later as a school district. As a district, we didn't seek this because we certainly had a full plate of things to do. But when it's a need and there was no other options available, we brought it into the school system. The community came to the point of embracing it, and we were really able to see some positive outcomes. You know, the health and wellness, we saw immunization percentages for our district, incoming kindergartners on-time immunizations as low as 2%, climbed to 98%. Building relationships with families. We had families with historical trauma, and that's very real. And being able to build those relationships while their children were young, and we were sharing these services and meeting these needs, really paid off later than when they were in the school system, which carried some distrust for some groups in our community. You know, that was a huge factor, building those relationships early, and certainly addressed the teacher discouragement and some of the recruitment issues that we were facing. So big challenges, but also big payoffs when you just look at the ground and see what are the issues and how do we address them in the best way we can. And I think Representative Summers said, unique to the needs of the community so the community can embrace it.
Yeah. You know, I think we're getting close towards the end of our time, but I do want to kind of just step back a little bit and talk a little bit more big picture. You know, I think that one of the things when I started researching for today and seeing, and I've done a lot of stories over the years about the serious health disparities in Wyoming for Wyoming's very young children. And that tells me that there is a lack of valuing this and why it is that very young children, infants and toddlers, why they matter. And so I wonder if we might be able to just kind of take a step back. I was thinking that Dr. Horami, that you might be able to tackle this one. Why is it, how can we convince people that this matters, that we need to be taking better care of our infants and toddlers?
Sure, Melody. You know, it really is a generation to generation concern, because as we see children raised in families that have less opportunity, why is it that they in turn create the same pathway for their children? And we need to stop that vicious cycle. You know, we've done a good job with some components of child abuse and neglect in that regard, stopping the intergenerational effects. But it comes back to these social determinants of health that we have to address. It's interesting, in my profession as a pediatrician for over 30 years, I've seen a transformation where, you know, it's been certainly a disease-focused profession, but now we're looking more and more at the quality of childcare. What does it take to have a patient-centered medical home where we provide continuity of care? And we utilize the Bright Futures template to improve our educational process with parents, and look at referral resources. You know, everybody's part of this aspect of having, whether it's WIC or STRIDE, which is a developmental program, Head Start, or preschools, being able to refer to genetics. All of these things have to be in place. And to break this cycle, we do have to have a commitment of devoted continuity of care. So I hope that, you know, I've been a part of the solution over the years, I do agree with Amy Speaker when she mentioned that maybe healthcare is only 10%, but if we can extend our impact through the referral of necessary programs, then we get everybody in the mix. I would tell you, when I see infants and young families, that is the time to make the difference. The other point I'd like to make before being with the loss of time is that we have 10% of our children in Wyoming uninsured. We should have a goal by 2030 to have all of them insured, either through expanded kid care or other programs. So I hope that answered your question.
Yeah, that does. And I wonder if I can pick up where you left off and ask the others on the panel, other goals that you think are the big priority right now, that you're just like, this is an emergency and we've got to tackle this one. Other people, anybody want to volunteer on what you feel like is where we really need to set goals?
This is Amy, and I guess I'll just have one thought. Thinking about your previous question about, kind of highlighting communities and how do we both make sure that those disparities are addressed without, maybe patronizing communities. And I think one of the things that I would like to see is more inclusion of those communities in the policy and in the process. And when I say policy, I mean big P policy, and what's happening at Head Start and in hospitals, and so that those community and boards of education, so that we can see those voices represented, because as many people have discussed, moms and families know what they need, and we can't provide those things and close those gaps without their input.
Yeah, so inviting and inviting again and inviting again, making sure people are feeling included. Other people's ideas of things that you'd really love to see us tackle?
This is Diana.
This is Albert.
Oh, go on, Diana. How about you? And then we'll circle back, Albert.
Okay. Thank you, Representative Summers. Just real quick, I would say access, given our remote locations and the ruralness of our state, and secondly, education. You might go in and ask people what they need. If it's something they have never experienced or know, they might not even know what some options and opportunities are. So access and education.
Great. Okay, Albert, finish your thought.
Melody, thanks. First of all, the community thing is so important, but I think what's lacking at a statewide level is really an advocacy for these issues. So when I go into the legislature and the lobbyists are out in the lobby, there's not too many there that are in this realm, in the early childhood education, that are talking to legislators every day, pulling them off to the side, trying to educate them on the issues. And I really think there needs to be more of that.
Yeah.
As difficult as it is.
As Amy's saying here, babies don't vote. And so that makes it a little harder for that to be a priority. I have been prompted that I would love to hear from the audience. What do you think is the emergency in Wyoming? Where do you think we should be setting our goals? So feel free to put that in the chat, and I'm happy to read those off as well. So Senator Cost, I'd love to hear your thoughts on what you're feeling like you would love to see in terms of setting goals.
Nothing like putting me on the spotlight.
I love doing it. It's my job.
Goal-wise, I think making sure through the early childhood stuff that we have organization that's working together better, communicating better and all, and I think that's on the move to become hopefully an answer in the future. I think also along with that, I agree with Albert, we need to have people talking to the legislature so that maybe we can get some things going a little bit. It can't all involve money because there's just not that much out there right now, but there are other opportunities for us to possibly come up with creative ways to help make things happen and to make awareness. I am passionate about kids and passionate about their education and all. And so obviously, because of that, I want to make sure that we do everything in our power to support these kids and to support families so that they can grow with the education of their kids and all as well, so these kids can become productive members of our society.
Yeah.
Are you gonna say one thing?
Yes, please.
Okay, I think one thing that I would like to see happen is back in the high schools for health education, family planning. These young girls, they don't have that home ec. They don't have that anymore. I think that would be a good start for it to be in the high schools, the way they used to have to take a baby home and just different things like that, and how they had to, you know, stay home and they couldn't go to the football game. I think that would be a start to put that back in the high schools.
Yeah, sort of preparing young women really at an earlier age to become parents, and letting them know that that's something that they want to be honing their skills early.
Yes,
to do
and
that.
they should even send the baby home with the guys.
Yeah. Yes.
Okay.
I am seeing, and I did want to ask Letty to also contribute some thoughts here as well, to how you're visualizing the direction we might need to go in terms of early childhood.
What resonates with me mainly is what you were all talking about. Wyoming is a small town, long streets, but in those long streets we have a lot of different cultures. I think it resonated with me what it was said about having representation from different cultures, but when you do that, also some sort of body system so that you can actually be effective when you get on boards or when you get into I mean, if you think about families that happen to be low income and they get on a board, it's so scary to speak at the beginning. So if we really want to find out what our populations need, we just need to really embrace them, so that this is a process that brings fruitful conversations. I'm always impressed with the talent that we have in Wyoming, and I love the spirit of Wyoming. You know, it's different for everybody, so it makes us more creative. So I'm sure we can find a balance between being creative and innovative, and investments in our very young, because we definitely are not where we should be.
Yeah, I know that we often, one of our weaknesses perhaps as Wyomingites is that we often think of ourselves as a very white state, and that we maybe, you know, don't have just racial injustice issues. But ultimately, when we start to look at those numbers and dig deeper, we see that actually a lot of the children that are really in need right now are from our minority groups. And, and so, you know, starting to really bring that into the way we think about ourselves as actually a pretty diverse community, and that we want to take care of everybody. I love that. I think that's wonderful. I did want to read from some of what I'm seeing flowing in. I think we need, this is from Samin. I think I'm pronouncing her name. I think we need to be face forward about what we value and what we're willing to pay for. Wyoming citizens have to think about across the board changes in our tax structure that can help us collectively pay for what we need in this state, and not think about the state as a series of communities that on their own need to be more supportive of one another. So thank you so much for that. I think we've heard from a little bit about that need to change our tax structure earlier as well. So I think that's something that I'd love to hear others talk about, but I do know that we are running out of time, but I just do want to read a couple more here. Tricia says, the senator said there isn't much money. A resource bank could increase access, like Diana mentioned, and possibly prevent unnecessary duplication of services. It would also be a platform to build upon. And from Britt, emergency in Wyoming equals opportunities for children and families to engage, interact, and continue learning and developing outside of school, communication networks between schools and families in whatever language is needed, school to work, vocational education, opportunities for kids for whom college is not necessarily the natural, the best fit. And so I'm seeing just so many great points coming in here. And I hope that you will all take some time to kind of look these over. I know I will be wanting to kind of go back and look those over, but we have pretty much run out of time here, but this has just been such a great conversation. It feels like we could have used a little bit longer to keep going, but thank you all so much for participating. And I know that we have another one next week. Michelle is saying that all of these points will be saved and synthesized and shared. And we hope that you will all be able to make it to next week's conversation when we have quite the lineup already scheduled. So thank you to everybody, and hopefully see you next week.
So I don't have a video, but yay, congratulations, everyone.
Yes, thank you.